Hi, I'm Manu Malbrain. I'm professor at the University Hospital in Brussels in Belgium, and I'm here to run a workshop on fluids and abdominal compartment syndrome at the 14th ECCC meeting. I believe it's about time that we should treat fluids as drugs and consider the 4D's of fluid management. It's a drug, it's the dose, duration and the escalation. But also there are 4 different phases during fluid therapy. According to the ROSE concept, we need to start with resuscitation, then comes optimization, stabilization, and finally we need to evacuate the excess fluids that have been given, which is referred to as de-resuscitation. Also, I think that intra-abdominal pressure and abdominal compliance is the neglected parameter in the critically ill.